We're talking about self-injury today. What is self-injury? For some people, it's cut or burn marks on their body. For others, it would be the pulling out of their hair. Lots of different things that people do to injure themselves. Often it's a secretive thing. Of course, today through social media, youth are sharing their experiences more and more online. Of course, lots of people are sharing experiences, even older people, but they're keeping it secret from the people closest to them. Why would people self-injure? Most of us can't understand this, right? It's important for us to understand that the person's usually not trying to kill themselves. Usually, the situation is that the person wants to feel pain, but without dying. So this is not suicide. If it's not suicide, then what is it? Well, for some people, they want to distract themselves from overwhelming feelings, or they might have unwanted thoughts, and so they're trying to deal with those. For some people, it's the releasing of tension. They have strong emotions, or they have thoughts that they want to get rid of. For some, it's feeling something physical when they're unable to feel something emotionally. Others want to express themselves to people in their lives and are unable to do so with words, and so self-injury is a way for them to communicate something. For some, they just want to punish themselves for whatever reason. And then, of course, some people have a temporary euphoria that comes with cutting or injuring themselves, and afterwards they have this feeling of euphoria after they do it. How do we initially respond to someone that is self-injuring themselves? Well, for a lot of us, we'd have shock and denial right away, or maybe anger and frustration. Hopefully we'll have some empathy, sometimes sympathy and sadness. Sometimes we feel guilty that we should be doing something to help them. How should we respond to someone who's struggling with self-injury? Well, we need to address the issues right away, of course, and we need to use our concern in a constructive way and try not to be condescending to the person. We don't want to validate their behaviors. Obviously, what they're doing is unhealthy, but we do want to try to validate the feelings that are underneath those behaviors or driving those behaviors. Be careful that you don't pressure the person. Often, the kind of people we're talking about are behaving the way that they are because they're having trouble verbalizing their feelings in the first place. So if you pressure them, that could be counterproductive. How can we better understand the person that is in front of us? Well, we really need to become curious about them and curious about what's going on with them. How do they feel just before they self-injure? Can we help them retrace the steps leading to it? What events, what thoughts, what feelings were there before? How does self-injury help them feel better? Because usually they're getting a payoff for this. Is there stress that they have in their lives that you might be able to help them with? Another question, is there something about your relationship with them that if you change that part of your relationship with them, it would help them deal with stress better and make a difference for them? Of course, we want to let the person know that you're a safe person to talk to about this. You can ask them if it's okay for you to approach them about this issue again, or if they would rather come to you. There's a lot more, of course, that we could share on this topic. In future videos, I'll probably share more about self-injury and how we can help people who are struggling with this kind of thing. If this video was helpful, I want to encourage you to pass it along to others. Thanks to Cornell Research Program for making this kind of information available online. You can search for Cornell Research Program on self-injury and recovery if you want to know more about this. May God bless you as you reach out to others and you become a safe person for them.